Hello, everyone, and welcome back to the English Speaking Nerds channel. We are so happy to see you here today. I'm your host, Maya.
And I'm John. This is the place where we help you speak real, natural English. Not boring textbook English, but the warm, practical language that people actually use when they talk to each other in everyday life.
That's right. And if you want to improve your English and learn how native speakers really communicate with healthcare professionals, please support us by clicking that like button right now and subscribing to English Speaking Nerds. Your support helps us so much and lets us keep making videos that truly help you grow.
We appreciate every single one of you. We love reading your comments and hearing about your experiences. Now, today we're talking about something that affects everyone, but many people struggle with, even native speakers. We're discussing how to talk to the doctor in English.
How to talk to the doctor. This is such a critical skill because your health depends on clear communication. When you can explain your symptoms, ask the right questions, and understand medical instructions, you get better care and better outcomes.
Absolutely. And here's something shocking, and please stay with us because we're going to reveal this later. There's one phrase that English learners constantly use at the doctor's office that actually prevents doctors from diagnosing you correctly. It's a seemingly innocent phrase that seems polite, but it can literally delay your treatment. We'll show you exactly what that phrase is and what to say instead.
And that's just one of the secrets we're sharing today. We're going to cover how to describe symptoms accurately, how to explain your medical history, how to ask questions confidently, how to understand medical instructions, how to discuss sensitive health issues, how to advocate for yourself, and so much more. Plus, we have a powerful technique at the end that native speakers use to make sure doctors take them seriously.
So, let's get started. Maya, why is it so important to know how to talk to doctors in English?
Oh, what a great question. Talking to doctors is important because medical communication can literally save your life. When you can clearly explain what's wrong, doctors can diagnose faster. When you ask good questions, you understand your treatment better. When you speak up about concerns, you avoid medical errors. Clear communication isn't just helpful, it's essential for your health and safety.
Yes, and there's something I call symptom vocabulary that everyone needs to know.
Symptom vocabulary. Tell everyone what that means.
Symptom vocabulary is all the specific words and phrases you use to describe what's happening in your body. Instead of just saying, I feel bad or something hurts, you can say, I have a sharp pain, I'm experiencing dizziness, I've been nauseous, I have a persistent cough. Having precise vocabulary helps doctors understand exactly what you're experiencing and where.
That's a perfect way to explain it. And these conversations require what I call medical confidence.
Medical confidence. What does that mean?
Medical confidence is when you talk to healthcare professionals as an equal partner in your care, not as someone who's intimidated or passive. You're respectful of their expertise, but you're also confident enough to ask questions, express concerns, and make sure you understand everything. You can say, I don't understand, can you explain that differently, without feeling embarrassed. This confidence ensures you get the care you deserve.
Perfect. And doctor visits follow what I call the preparation principle.
The preparation principle. That sounds interesting.
The preparation principle is the idea that the more prepared you are before the appointment, the better the conversation will go. Good patients don't just show up and hope for the best. They write down their symptoms, list their questions, bring their medications, and know their medical history. This preparation makes the appointment more efficient and more effective.
Excellent. And many English learners face what I call the minimizing trap.
The minimizing trap. Explain that.
The minimizing trap is when you downplay your symptoms because you're worried about wasting the doctor's time or sounding dramatic. You might say, it's probably nothing, or I'm sorry to bother you, when you're actually experiencing something serious. But doctors need accurate information, not apologetic information. Learning to describe symptoms honestly and completely helps doctors help you.
That's so important. And remember that dangerous phrase we mentioned? Here it is. Many learners say, "I'm fine," or "I feel okay," when the doctor asks follow-up questions, even when they're not fine. This phrase stops the conversation and prevents the doctor from getting the full picture. Instead, be specific and honest. "Actually, I'm still experiencing pain. The symptoms are getting worse. I'm concerned because—" Don't say you're fine when you're not.
Perfect explanation. Now let's talk about the different parts of a doctor's appointment. What are the main stages?
A typical appointment has several stages: the greeting and check-in, explaining your chief complaint, answering the doctor's questions, the physical examination, discussing diagnosis and treatment, asking your questions, and understanding the next steps. Each stage has its own vocabulary and communication style. Let's explore them one by one.
Let's start with the greeting and check-in. What happens at the beginning of the appointment?
The nurse or doctor will greet you and ask initial questions. They might ask, "How are you doing today? What brings you in today? What seems to be the problem? What can I help you with?" These are your opening to explain why you're there.
How should you respond to these opening questions?
Be direct and specific. Instead of "I don't feel good," say, "I've been having severe headaches for the past week. I have a rash that won't go away. I've been experiencing chest pain. I'm here for a follow-up on my blood pressure." Get straight to the main issue immediately.
What if you have multiple concerns?
Prioritize. Start with the most serious or bothersome issue. "My main concern today is this persistent cough, but I also wanted to ask about my knee pain." Or, "I have 3 things I'd like to discuss: my insomnia, my digestive issues, and a refill on my prescription." Being organized helps the doctor address everything efficiently.
Excellent. And many English learners face what I call the minimizing trap.
The minimizing trap. Explain that.
The minimizing trap is when you downplay your symptoms because you're worried about wasting the doctor's time or sounding dramatic. You might say, "It's probably nothing," or "I'm sorry to bother you," when you're actually experiencing something serious. But doctors need accurate information, not apologetic information. Learning to describe symptoms honestly and completely helps doctors help you.
That's so important. And remember that dangerous phrase we mentioned? Here it is. Many learners say, "I'm fine," or "I feel okay," when the doctor asks follow-up questions, even when they're not fine. This phrase stops the conversation and prevents the doctor from getting the full picture. Instead, be specific and honest. "Actually, I'm still experiencing pain. The symptoms are getting worse. I'm concerned because—" Don't say you're fine when you're not.
Perfect explanation. Now let's talk about the different parts of a doctor's appointment. What are the main stages?
A typical appointment has several stages: the greeting and check-in, explaining your chief complaint, answering the doctor's questions, the physical examination, discussing diagnosis and treatment, asking your questions, and understanding the next steps. Each stage has its own vocabulary and communication style. Let's explore them one by one.
Let's start with the greeting and check-in. What happens at the beginning of the appointment?
The nurse or doctor will greet you and ask initial questions. They might ask, "How are you doing today? What brings you in today? What seems to be the problem? What can I help you with?" These are your opening to explain why you're there.
How should you respond to these opening questions?
Be direct and specific. Instead of "I don't feel good," say, "I've been having severe headaches for the past week. I have a rash that won't go away. I've been experiencing chest pain. I'm here for a follow-up on my blood pressure." Get straight to the main issue immediately.
What if you have multiple concerns?
Prioritize. Start with the most serious or bothersome issue. "My main concern today is this persistent cough, but I also wanted to ask about my knee pain." Or, "I have 3 things I'd like to discuss: my insomnia, my digestive issues, and a refill on my prescription." Being organized helps the doctor address everything efficiently.
Excellent. And many English learners face what I call the minimizing trap.
The minimizing trap. Explain that.
The minimizing trap is when you downplay your symptoms because you're worried about wasting the doctor's time or sounding dramatic. You might say, "It's probably nothing," or "I'm sorry to bother you," when you're actually experiencing something serious. But doctors need accurate information, not apologetic information. Learning to describe symptoms honestly and completely helps doctors help you.
That's so important. And remember that dangerous phrase we mentioned? Here it is. Many learners say, "I'm fine," or "I feel okay," when the doctor asks follow-up questions, even when they're not fine. This phrase stops the conversation and prevents the doctor from getting the full picture. Instead, be specific and honest. Actually,
Perfect explanation. Now let's talk about the different parts of a doctor's appointment. What are the main stages?
A typical appointment has several stages: the greeting and check-in, explaining your chief complaint, answering the doctor's questions, the physical examination, discussing diagnosis and treatment, asking your questions, and understanding the next steps. Each stage has its own vocabulary and communication style. Let's explore them one by one.
Let's start with the greeting and check-in. What happens at the beginning of the appointment?
The nurse or doctor will greet you and ask initial questions. They might say, "How are you doing today? What brings you in today? What seems to be the problem? What can I help you with?" These are your opening to explain why you're there.
How should you respond to these opening questions?
Be direct and specific. Instead of, "I don't feel good," say, "I've been having severe headaches for the past week. I have a rash that won't go away. I've been experiencing chest pain. I'm here for a follow-up on my blood pressure." Get straight to the main issue immediately.
What if you have multiple concerns?
Prioritize. Start with the most serious or bothersome issue. "My main concern today is this persistent cough, but I also wanted to ask about my knee pain." Or, "I have 3 things I'd like to discuss: my insomnia, my digestive issues, and a refill on my prescription." Being organized helps the doctor address everything efficiently.
Now let's talk about describing symptoms. This is crucial. What's the framework for describing symptoms well?
I teach what I call the LOFS framework: location, onset, frequency, type, and severity. When you describe a symptom, answer these 5 questions. Where is it? When did it start? How often does it happen? What does it feel like? How bad is it? This gives doctors complete information.
Can you give an example using lofts?
Sure. Instead of saying, "My stomach hurts," you say, "I have pain in my lower right abdomen." Location: it started 3 days ago. Onset: it's constant, but it gets worse after eating. Frequency: it feels like a sharp stabbing sensation. Type: on a scale of 1 to 10, it's about a 7. Severity: see how much more useful that is?
That's incredibly helpful. Now let's talk about vocabulary for describing pain. What are the different types of pain?
Pain can be sharp, like a knife; dull, like a constant ache; throbbing, a pulsing sensation; burning, like fire; stabbing, sudden and severe; shooting, travels quickly; cramping, muscles tightening; aching, continuous discomfort; tender, hurts when touched; or stiff, hard to move.
Can you use these in sentences?
I have a sharp pain in my chest when I breathe deeply. There's a dull ache in my lower back that won't go away. I feel a throbbing pain in my temples. My foot has a burning sensation. I get shooting pains down my leg. Each word paints a different picture for the doctor.
What about describing the intensity of symptoms?
For mild symptoms, slightly uncomfortable, a little sore, a mildly annoying, barely noticeable. For moderate, pretty painful, quite uncomfortable, significantly bothersome, interfering with daily activities. For severe, extremely painful, unbearable, the worst pain I've ever felt, I can't function normally, it's debilitating.
What phrases help describe when symptoms happen?
For timing, it happens every morning.
It comes and goes. It's constant. It's worse at night. It started suddenly. It developed gradually. It's been going on for weeks. For triggers, it happens when I eat. It's triggered by stress. It gets worse when I stand. It improves with rest.
Now let's talk about other symptoms besides pain. How do you describe different types of symptoms?
For respiratory symptoms, I have a cough, I'm short of breath, my chest feels tight, I'm wheezing, I have congestion, my nose is running, I have postnasal drip, I'm coughing up phlegm.
What about describing coughs specifically?
Coughs can be dry, no mucus, productive, bringing up phlegm, persistent, won't go away, intermittent, comes and goes, hacking, harsh and frequent, barking, sounds like a seal. You can say, I have a dry, persistent cough that's worse at night. I'm coughing up green phlegm. My cough keeps me awake.
What about digestive symptoms?
For digestive issues, I have nausea, I've been vomiting, I have diarrhea, I'm constipated, I have acid reflux, I feel bloated, I have no appetite, I have indigestion, I'm experiencing heartburn. How do you describe these symptoms more specifically? Add details. I've been vomiting 3 times a day for 2 days. I have diarrhea with blood in it. I'm so constipated I haven't had a bowel movement in 5 days. I have acid reflux every night after dinner. I feel nauseated all day, especially in the morning. Specifics matter.
What about neurological symptoms?
For brain and nerve symptoms, I have a headache, I feel dizzy, I'm experiencing vertigo. I have numbness, I have tingling, I feel weak, I'm having trouble concentrating, I have brain fog, I'm experiencing memory problems.
What about describing headaches?
Headaches can be tension headaches, band around your head, migraines, severe, often one-sided with nausea, cluster headaches, intense around one eye, sinus headaches, pressure in face. Say, I have a pounding migraine on my right side. I feel pressure around my sinuses. There's a tight band around my head. What about skin symptoms? For skin issues, I have a rash, I have hives, my skin is itchy, I have a lesion, I have a bump, I have a mole that's changed, my skin is dry and flaky, I have blisters, I have swelling.
How do you describe rashes?
Describe location, appearance, and behavior. I have a red itchy rash on my arms that appeared yesterday. There's a raised bumpy rash spreading across my chest. I have small red dots on my legs that don't itch. The rash appeared after I started taking the new medication.
Now let's talk about the medical history part of the appointment. What will doctors ask about?
Doctors will ask about past illnesses, surgeries, current medications, allergies, family medical history, lifestyle factors like smoking or drinking, and previous treatments you've tried. Being prepared with this information saves time and helps diagnosis.
How do you talk about past medical conditions?
Use present perfect or simple past. I was diagnosed with diabetes 5 years ago. I had my appendix removed in 2018. I've had asthma since childhood. I suffered from depression. I was hospitalized for pneumonia last year.
What about medications?
List them clearly. I'm currently taking metformin twice daily for diabetes. I take 20 milligrams of lisinopril for high blood pressure. I'm on birth control pills. I use an inhaler as needed for asthma. Know the names, dosages, and frequencies.
What if you don't know the exact name?
Describe it. I take a small white pill for my thyroid every morning. I'm on a blood pressure medication, but I don't remember the name. Can I show you the bottle? It's okay to bring your pill bottles to appointments.
How do you talk about allergies?
Be specific about reactions. I'm allergic to penicillin. It gives me hives. I have a severe peanut allergy that causes anaphylaxis. I'm allergic to latex. Sulfa drugs make me break out in a rash. Describe what happens, not just what you're allergic to.
Now let's talk about family medical history. Why does this matter?
Family history shows risk factors. Doctors want to know, does anyone in your family have heart disease? Is there a history of cancer? Do diabetes or high blood pressure run in your family? How do you answer these questions?
Yes, my father had a heart attack at age 55. My mother has type 2 diabetes. Breast cancer runs in my family. My grandmother and aunt both had it. No, there's no family history of that. I don't know my family medical history because I was adopted.
Now let's talk about the physical examination. What communication happens during the exam?
The doctor will tell you what they're doing. I'm going to listen to your lungs. I need to check your blood pressure. I'm going to examine your abdomen. Look straight ahead while I check your eyes. They'll also ask, does this hurt? Can you take a deep breath? Can you turn your head? How should you respond during the exam? Be honest and specific. Yes, that hurts. No, I don't feel anything there. That's tender. That's the exact spot. That makes it worse. That actually feels better. Don't try to be tough. Accurate feedback helps diagnosis.
What if something is uncomfortable or painful during the exam?
Speak up immediately. That really hurts. That's very uncomfortable. Can we take a break? I need you to stop for a moment. You have the right to communicate discomfort and ask for adjustments.
Now let's talk about asking questions. This is where many people struggle. Why is asking questions important?
Asking questions ensures you understand your diagnosis, treatment, and next steps. It's not rude or bothersome. It's your right as a patient. Doctors expect questions, and good doctors welcome them. Your health is too important to leave confused.
What are essential questions to ask about a diagnosis?
Key diagnosis questions. What do I have? What caused this? Is it serious? What happens if it's not treated? How long will it last? Is it contagious? Will it come back? Can you give examples in context? You mentioned I have bronchitis. What exactly caused it? Is this something that will go away on its own, or do I need treatment? You said I have high blood pressure. What does that mean for my long-term health? Always ask for clarification.
What questions should you ask about treatment?
Treatment questions. What are my treatment options? Why are you recommending this treatment? What are the side effects? How long will treatment take? How will I know if it's working? What happens if this doesn't work? Are there alternatives? Can you give specific examples? You're prescribing this antibiotic. How long do I need to take it? What are the common side effects I should watch for? Should I take this with food? What if I miss a dose? When should I start feeling better? These questions help you follow treatment correctly.
What about questions about tests?
Test questions. What is this test for? How is it done? Do I need to prepare for it? When will I get results? What are the risks? Is it painful? How much will it cost? What if you don't understand medical terminology? Always ask for translation. I don't understand that term. Can you explain it in simpler words? What does that mean exactly? Can you say that another way? I'm not familiar with that. Can you break it down for me? Never pretend to understand.
Now let's talk about that powerful technique we promised. This is how native speakers make sure doctors take them seriously. What is it?
It's called the impact statement. Instead of just listing symptoms, you explain how the problem affects your daily life. You say things like, this pain is preventing me from working. I can't sleep through the night because of this. I'm unable to exercise anymore. This is affecting my ability to care for my children. Impact statements show severity and urgency.
Why does this technique work?
It works because it helps doctors understand the real-world consequences of your condition. A headache sounds manageable, but headaches that are so severe I had to miss 3 days of work this week signals something serious. Impact statements show doctors this isn't something you can just ignore.
Can you give more examples?
This knee pain means I can't walk my dog anymore, and that's my main form of exercise. My anxiety has gotten so bad that I'm avoiding social situations I used to enjoy. I'm so exhausted that I'm falling asleep during the day, and it's affecting my job performance. This rash is so itchy I'm scratching until I bleed. These statements demand attention.
Now let's talk about discussing sensitive health issues. How do you bring up embarrassing or private topics?
First, remember that doctors have heard everything. They're professionals who deal with bodies all day. Nothing you say will shock them. You can start with, this is embarrassing, but I'm uncomfortable discussing this, but I need to. This is private, but it's important.
What are some sensitive topics people struggle to discuss?
Sexual health issues, bathroom problems, mental health concerns, substance use, body odor, intimate area problems, reproductive issues, and STD concerns. All of these are important medical topics that doctors need to know about.
How do you approach these topics directly but professionally?
Use medical language when possible. I've noticed changes in my bowel movements. I'm experiencing erectile dysfunction. I think I might have depression. I'm concerned about an STD. I've been having discharge that's unusual for me. Be direct. Doctors appreciate clarity.
What if you're too embarrassed to say it out loud?
Write it down. Bring a note that says, I'm experiencing symptom, or I need to discuss issue. You can hand it to the doctor and say, I wrote this down because it's easier than saying it out loud. Doctors will understand and appreciate your effort.
Now let's talk about understanding medical instructions. How do you make sure you understand what the doctor tells you?
Use the teach-back method. After the doctor explains something, say, let me make sure I understand. You're saying I should. Then repeat back what you heard in your own words. The doctor can correct any misunderstandings.
What's a good example of teach-back?
Doctor, take this medication twice daily with food for 10 days. Okay, so I should take 1 pill in the morning with breakfast and 1 pill in the evening with dinner, and I need to finish all 10 days even if I feel better. Is that right? Doctor, exactly. This confirms you understand.
What if you need the doctor to slow down or repeat something?
Say directly, I'm sorry, could you repeat that more slowly? I'm having trouble following. Could you go through that again? That's a lot of information. Can you write down the key points? Could you show me how to do that? Don't let them move on until you understand.
What about taking notes during appointments?
Taking notes is excellent. Say, do you mind if I take notes so I remember everything? Or ask, could you write that down for me? You can also ask, do you have a handout about this? Many doctors have printed information sheets.
Now let's talk about follow-up care. What questions should you ask before leaving?
Follow-up questions. When should I come back? What should I do if I don't improve? What symptoms mean I should call you or go to the emergency room? When will my test results be ready? How will you contact me with results?
What about prescription clarifications?
Ask, where should I fill this prescription? Does my insurance cover this? Is there a generic version? Can I take this with my other medications? What should I do if I experience side effects?
Now let's talk about advocating for yourself. What does this mean?
Self-advocacy means speaking up when you feel something isn't right, asking for second opinions when needed, insisting on certain tests, and not accepting dismissive treatment. You know your body better than anyone. If something feels wrong, you have the right to push for answers.
What phrases help you advocate for yourself?
I'm really concerned about this. I don't think this is normal for me. I'd like to explore other options. I'd like a second opinion. I want to try a different treatment. This isn't working for me. I need you to take this seriously.
What if a doctor dismisses your concerns?
Be firm but respectful. I understand what you're saying, but this is significantly affecting my quality of life and I need help. I'd appreciate if we could investigate this further. If you don't think it's serious, can you explain why? And remember, you can always seek a different doctor if one doesn't listen to you.
Now let's talk about telephone and telehealth appointments. How do these differ from in-person visits?
Phone and video appointments require extra clarity since the doctor can't examine you physically. You need to be even more descriptive about symptoms, and you should prepare questions in advance. Technical phrases, can you hear me clearly? Your video is frozen. I'm having trouble with the connection.
What about leaving messages for doctors?
When leaving a message, state your name clearly, date of birth, reason for calling, and phone number. Example, hi, this is Maria Rodriguez, date of birth June 15, 1985. I'm calling about severe stomach ache I've been having for 3 days. My number is, phone, please call me back. Thanks.
What about communicating at the pharmacy?
At the pharmacy, I'm here to pick up a prescription. I'm dropping off a prescription. When will this be ready? Can you check if my insurance covers this? What's the cost? Do I need to take this with food?
Are there any interactions with my other medications? Now let's talk about emergency situations. How do you communicate in emergencies?
In emergencies, be direct and urgent. Say, I need help immediately. This is an emergency. I'm having chest pain. I can't breathe. I'm bleeding heavily. Someone has collapsed. State the most critical information first.
What information do you need to give to emergency services? For 911 calls, your location, what happened, the patient's condition, whether they're conscious and breathing, any visible injuries, and any medical conditions or medications. Example, I'm at 123 Main Street. My husband is having chest pain. He's conscious but in severe pain. He's diabetic and takes heart medication.
What about urgent care versus emergency room?
Ask, should I go to the emergency room or urgent care? Urgent care is for, I cut my hand and might need stitches. I think I have strep throat. I twisted my ankle badly. Emergency room is for, I'm having chest pain. I can't breathe. I'm bleeding uncontrollably. I think I'm having a stroke.
Now let's talk about cultural differences in medical communication. What should international patients know?
Different cultures have different comfort levels with directness, eye contact, discussing certain topics, and questioning authority figures. In American healthcare, being direct, asking questions, and advocating for yourself is expected and encouraged. Don't worry about being too forward. Speak up.
What if your culture taught you to never question doctors?
You can acknowledge this. In my culture, we're taught to accept the doctor's decisions without question, but I'm learning that in this healthcare system, I should be more involved. I have some questions. This shows awareness while practicing new communication patterns.
What about language barriers?
If you struggle with English, you have the right to an interpreter. Say, I need an interpreter. Can we use a translation service? Do you have anyone who speaks language? Professional medical interpreters are available in most healthcare settings. Don't rely on family members for sensitive discussions. Request a professional.
What about bringing someone with you to appointments?
Bringing a support person is great. Say, is it okay if my family member or friend comes in with me? They can take notes, ask questions you forget, and help you remember information. This is especially helpful for serious diagnoses or complex treatment discussions.
Now, let me ask you personally, John. Have you ever had a challenging medical communication experience?
Yes, actually. A few years ago, I was having unexplained dizzy spells, and the first doctor I saw dismissed it as stress. But I knew something was wrong. These weren't normal for me. I advocated for myself by saying, I appreciate your perspective, but these symptoms are significantly affecting my work and daily life. I'd like to explore this further. I ended up seeing a specialist who discovered I had an inner ear problem that was totally treatable. If I hadn't spoken up, I'd still be suffering. That experience taught me that self-advocacy isn't being difficult, it's protecting your health. What about you, Maya?
Thanks for sharing that. My challenging experience was when I was dealing with anxiety but didn't know how to bring it up with my doctor. I felt embarrassed and kept saying I'm fine even though I wasn't. Finally, during one appointment, I just said, I need to talk about my mental health. I've been struggling with anxiety and I need help. My doctor was so supportive and explained that mental health is just as important as physical health. That conversation changed my life. I learned that doctors are there to help with all health concerns, not just physical ones, and that speaking up about mental health is brave, not weak.
I love that example. It shows that the hardest part is often just starting the conversation. Once you begin talking, doctors are usually very understanding and helpful.
Exactly. And notice how we both used the impact statement technique, explaining how our health issues affected our lives. That's what made our doctors take us seriously.
Now, we want to hear from you. Tell us in the comments, have you ever had trouble communicating with a doctor in English? What was challenging about it? Or share a tip that helped you communicate better with healthcare providers.
This is a judgment-free zone. Medical communication is difficult even for native speakers, and we're all learning together. Your experiences can help others feel less alone.
And if this video helped you feel more confident about talking to doctors in English, please give us a thumbs up. It helps us know you want more content like this.
Please share this video with anyone learning English who might need to visit a doctor, or anyone who wants to improve their medical communication skills. This could genuinely help someone get better healthcare.
Subscribe to English Speaking Nerds if you haven't already, and turn on notifications so you never miss our lessons. We're here every week to help you speak English naturally and confidently in real-life situations.
Until next time, stay nerdy, stay curious, and remember that your health matters. Your questions are valid, and you have the right to clear communication with your healthcare providers.
Thank you for being part of our community.
Keep learning, keep growing, and keep advocating for your health.
We can't wait to hear your medical communication stories in the comments.
See you in the next episode.
Take care and stay healthy. Bye.